Anyway.
So usually around typically.
Yeah.
If they would, I wish they would ask me.
She called me today.
But we have heard about it,
But I couldn't talk to her.
or I've seen
That's full day.
it passing by or driving by.
Pretty,
Oh, you gotta turn off your mute, yeah.
Oh, they have it in Enid.
Yeah.
They have one in Enid, right?
Oh, those are good.
I think next to a hospital.
Trying some food. Oh, I don't want to go up
That's not Rodney.
there. I
Here's
need to
your
find
burger.
some-
Also get diabetes. Not from the hospital.
Yeah.
Yep.
No.
So I mean, comes all over.
Now, the ambulance right by the phrase.
Yeah.
Okay,
It's in the right spot.
here's some other concepts. I want to get to the meat and potatoes. The stuff that I just showed you with the process, that's probably not going to be on your NCE. But hopefully that will be something that you use to do counseling. Let's go ahead and get into the things that probably will be on your NCE. So when you're looking at therapies, you know, we want to sometimes consider process versus content. If we're looking at you know, systems and family structure, and looking at, okay, what's important? Is it the content of what's said? And sometimes we do. A lot of times when we're doing cognitive behavioral therapy, we're really looking at content, like what we just did there. But there's a lot of models of family therapy that want you to look at process. So, for instance, it's not what you say, but how you say it. And so, with Bowen therapy, Murray Bowen, he talks about a concept about I messages, I statements. This is kind of a takeoff of that, and this is something you can use in your therapy as well to help people understand there's better ways of communicating. You always leave the toilet seat up. I don't understand. It's always up. You never remember me whenever you're getting dinner, or you always yell. Okay, well, there's a lot of red flags going up with cognitive therapists. You're going, okay, you use never and always, so that's not good. But what's problematic about the way I started those sentences?
You're placing the blame on them. I mean, you're just saying you when it's, well, actually just the way your feelings.
Yeah, you want to state an I feel statement instead of you, which puts a person on defensive and automatically, I don't care who you are, you become, you're going to have that, your hypothalamus and your amygdala pumping this adrenaline, and you're going to start not thinking with your cerebral cortex, but start reacting in fight or flight. You're going to get defensive. So when you're talking with families, and this comes from a lot of different models, try to get them to use I feel statements. So this is a process. So it's not what you say, but how you say it. So, for instance, Lauren, I feel sad when you come to class drunk, come to class intoxicated, because it makes me feel like you don't care what I have to say. So, versus, you're an alcoholic, why are you here? So, that would be a bad way to say that, especially, you know, as a therapist. But secondly, if you want to talk to your family member about their substance use, it would be advisable not to say, you're just a no good pothead. It would be advisable to say, I feel upset and scared and worried. Use a lot of feeling words. We're therapists, we got all the feeling words. When you smoke THC every day, because it tends to make people lazy. So at least you have not said, you're lazy, you're a pothead, and start a fight. You've shown somebody how you feel. That very, very action takes away the defensiveness. So if you can get people structured into using these, you will see a change in that loop that we were talking about there, that feedback loop. Another good thing to do would be if you have people that have a tendency to get very, very emotional and upset, would be to use timeouts. Okay, we're gonna agree. Okay, I'm the therapist, so we're gonna agree that when one of you call a timeout, you have to everybody has to respect each other and get away for 10 minutes. Now, it doesn't mean we're not ever gonna come back and talk about it, but it means that you take a timeout for 10 minutes and then think in that time, think of an I statement or a different way of saying what you're trying to say, where it shows what you're feeling, where you communicate how you're feeling to that other person without blaming them. And then brainstorming. Compromise a win-win structure. For instance, if two people are fighting and they're blaming each other, you never listen to me, you never go grocery shopping, you never have sex with me. I mean, hopefully you can then come to an agreement where people are okay, well, what I'm hearing then as a therapist, what I'm hearing then is you want them to help with the dishes more, or you would like to be intimate more. Let's talk about, is there a way that we can compromise that?
I have one for that.
You have one for that.
I think it was even me. I'm quoting a book I read. It was talking about that book, it's by the guy who wrote the 5 Love Lessons. The 5
Life Lessons?
Love languages. The things you wish you knew before you got married. He talks about compromise, and there he was talking about a situation which where they were going to spend the holidays. She wanted to spend it with a family member because they might not
Be around
very much longer, but he wanted to spend it with his family member because, and not his family because of, a different reason. So they came up with, well, we'll spend X amount of days there and then X amount of days here. That just, anyway.
The win-win, exactly. And so if you can facilitate that, and what your job as a therapist is to hopefully facilitate a change in how they're processing that information among themselves, where they can get there without coming to therapy. Another thing to look at is family structure. The roles and personalities of family members in their system. And you have a lot of older addiction that really label family members like the scapegoat or the joker or the worker, or you have different labels for people. I tend not to go with that, but I mean there is something to keeping somebody's personality in mind, because then there's subsystems and boundaries. You can have enmeshed parents, you can have disengaged parents, and how would either of these impact the use of substances? If you have completely disengaged or completely enmeshed parents, that's definitely going to impact the use of substances. Okay, Murray Bowen talked a lot about, and this is moving along at a snail's pace in our book, moving along to page 76. You know what we probably can? Well, I'll sleep at this. Murray Bowen was working with schizophrenics and wanted them all to come to, with the family members, wanted the family members to come to treatment as well. And then started to think about therapy a little bit differently. And so, between Bowen's discussion of fusion, looking at having a balance between individuality and togetherness. If you have people that are in parents especially in a state of fusion, symbiosis, enmeshment, you're not going to have healthy development. If you have a state of complete differentiation, you're not going to have a healthy state of development. What Bowen is really looking for in this is a healthy balance, and what I termed it to be an interdependence, and that's again mine, not Bowen's. And so if you're illustrating this for a couple, I like to use the two circles, where if you have the wife here and the husband or other partner here, each have their own, significant amount of their own life, but then they have this shared life together here. That is a healthy relationship. And anytime you have a dyadic relationship, two people, you can use this model. You could also apply this to, say, mother and son, or mother-daughter, husband-daughter, husband-son, and have that same type of, how close are they, how far apart are they, to help you understand how much of their life do they actually share. One thing that's important when you're working with folks with domestic violence, I use this model a lot. Let's say that if you're working in a relationship where there's domestic violence, you will often have this fusion be the dynamic. In other words, one partner, and this overlapping, let's call this the male partner. One partner is so controlling that they force, and oftentimes the submissive partner here allows that much of their identity to be controlled by the controlling partner. And I use male because they're overwhelmingly the offender in this situation. Although it can be, vice versa. So the controlling partner takes up this identity. And so what happens then, when the controlling partner leaves, which that usually doesn't happen because they're controlling, but let's say this person, the wife in this situation, decides to leave. Well, when the wife leaves, and you take away this controlling partner, how much of her own identity is left? A sliver, a little crescent moon of identity. There's not much left there. So this then becomes the process of therapy, because this out here, without having someone to take care of, someone that's because many times in that person's life, that's where they get their fulfillment from, is this is what I'm taking care of him, I'm doing my role as a wife, this is what I'm supposed to be doing. And so if that leaves, this becomes scary, because then who am I? That's many times more frightening than the prospect of staying. So it gets, and truthfully, it can be scary to leave, because 75% of homicides happen in domestic violence when the wife or the partner breaks away. So that's a very scary time for separation. Something to keep in mind when you're working with, very important to have a safety plan working with DV for the person that may be leaving. But then what happens, and what tends to happen when you have just a crescent moon of identity left with victims of domestic violence. What tends to happen is the controlling partner will be allowed back in. Oh, it's okay. I love you. I'm so sorry. Here's some roses. I promise I'll make it up to you. I'm gonna make your life better. Everything's gonna be good. I won't do those things again. So there'll be that honeymoon. Or I've seen this, jumping right back into another DV relationship, because that personality. It's funny how opposites attract, and somebody that is not controlling and very submissive gets into a relationship with somebody that's very domineering, and often, you know, you don't see the violence up front because they're charming, and so oftentimes I've seen moving from a DV relationship into another DV relationship. Something to keep in mind. Triangulation. We actually did a little bit of work on triangulation. Talked about what triangles look like. How do you manage triangles as a therapist? That's a good question. What would be some thoughts?
I have a few thoughts.
Okay.
You don't. Well, first of all, and at least the family therapy especially required. You said, well, the one you mentioned before, which is you don't want to get into a situation, obviously, where one is telling you, well, I'm going to tell you this, but I don't want you to share it with the other one.
Yeah.
But also, when you're doing at least family therapy as well, just from the class model that we had to do with Jessica had a family for us that came up here every week, and they do kind of, I guess they do kind of scapegoat somebody, and that person can be you.
Right, it can be a therapist.
I mean, so
absolutely.
they can be quick to point things out about each other, but if they feel like they can, basically kind of like one of those things, well, we can make comments about each other, but don't you make comments about, kind of comments about
No
us.
scapegoating.
Do you know what I mean?
Yeah, I can say that about my mother. It's like, well.
We can make comments about our own family members, but don't you make comments about our family members? You know what I mean? So
Then they
can very quickly turn. I mean, they can turn on each other, but they can turn on you as well.
Yeah.
So I mean, those are some of the things.
So yeah, if you have the triangle, here's the diagram of the triangle. You have something that they all share here, but then you have some that, say this is the parents up here, their relationship. Then you have, and you're going to have a little bit of triad in everybody, in every three people relationship, a little bit where they don't share with the mom. Here's some with the parents. So you want to minimize that. So no secrets, no scapegoating. What else did we talk about? How do you effectively manage triangles?
Not becoming part of the triangle.
Absolutely.
And establishing a better communication between them.
Well, I guess that's kind of what I meant when I meant don't become the scapegoat, don't become part of it.
Yes. Rules and communication. Rules for communication. Absolutely. It's sometimes, I will tell you this. Sometimes if you have somebody with a severe personality disorder, somebody that's very, very borderline or very, very narcissistic, and it's just part of their personality, I've come to the point where in that case, if you're dealing with a personality disorder, it's very difficult and pretty almost darn near impossible to manage. And then it's like we are just creating a triangle to deal with that person's dysfunction. I don't know of a good way of overcoming that.
I was gonna say the family we had, she'd have us create the family ourselves, and we built a monster one. The semester I was in it, and the dad in our situation was narcissistic, and so of course it wasn't necessarily a triangle because it was a family group with his wife and his 2 kids.
2 kids.
Three
yeah.
kids actually, but one never showed up a whole lot. She came maybe once because she would run away all the time. But he was narcissistic, so but he was also the person paying for these services.
Therapy. Yeah.
So you didn't want to rub him the wrong way because you wanted to come in, but you also you kind of had to feed
Ego.
But you know, there wasn't a lot of people that wanted to mess with him either because he could get off on some
Bad tangent.
Yeah.
Yeah.
So he was one that you kind of wanted to appease, but you didn't want to aim too much stuff at because you weren't getting much.
You weren't
You
gonna
weren't
get
going to
much.
get anywhere with him. So.
Yeah, I think that's the main thing to recognize when it comes down to it. If you do recognize a personality disorder, you're not going to get very far because they're not very easily changed.
Well, because it wasn't, there was nothing wrong with him.
Right. So on page 77, at the bottom of the page, it says all families vary. In the first column, along a continuum from emotional fusion to differentiation. So that prior slide where I illustrated the fusion versus differentiation, that's what that is partly for. Two names that you should be familiar with on page 77 in the second column are Philip Gering and Thomas Fogerty. They are folks that follow Bowenian therapy, and as well as at the bottom of the page, Betty Carter and Monica McGoldrick. They're very important as well. They in a time and space where there's not a lot of multicultural looking at families, they tend to allow the study of family therapy to move into looking at other cultures and other type of relationships besides patriarchal dominated ones. So differentiation of self on 78. If I could have a reader on the left side of 78 there. Yes.
The cornerstone of Bowen's theory is both an intrapsychic and interpersonal concept, roughly analogous to ego strength. Differentiation of self is the capacity to think and reflect, to not respond automatically to emotional pressures. It is the ability to be flexible and act wisely even in the face of an anxiety.
So that's what we want our clients to be able to do. He talked about emotional triangles. Sonia, if you don't mind, the second paragraph there and just a little bit under emotional.
Okay, I'm sorry. You said
under emotional
like to take a minute.
Actually, the one under that.
Oh, what drives?
Yes.
Okay, I'm sorry.
That's okay.
Okay. What drives triangles is anxiety. As anxiety increases, people experience a greater need for emotional closeness, or to avoid pressure, a greater need for distance. The more people are driven by anxiety, the less tolerant they are of one another, and the more they are polarized by differences.
Okay, and then at the next paragraph at the bottom, it says, if the third party's involvement is only temporary, or pushes the two people to work out their differences, the triangle doesn't become fixed. But if the third person stays involved, as often happens, the triangle becomes part of the relationship. So then it says, thus, for example, a wife upset with her husband's distance may increase her involvement with one of her other children. So you can see that that you've got some unhealthy things happen. And unfortunately, like I said, and like Lauren noted, when you have a person that's a personality disorder in the mix, these become very dysfunctional and very, very fixed in that family system. Now I'll say at the top of 79, the last paragraph before multi-generational, triangulation lets off steam but freezes conflict in place. It isn't that complaining or seeking solace is wrong, but rather that triangles become diversions that undermine relationships. I guess you could say I'm not quite completely Bowenian because I just recognize times when triangles become, especially like I said, with some real personality dysfunction. And think of it this way, from what you read, Sonia, where you talk about the need for emotional closeness or to avoid pressure, a greater need for distance. That's what a person with a poor attachment, with one of these personality disorders. That's what I'm saying. Keep when you're thinking about relationships, keep attachment theory in your mind, because somebody that's approaching avoidant, they're working through that, how they were wired as children. Okay, well, I just feel like I need to be close to them. That domestically violent person, whatever happened to them that made them with that need for control and not to value and love somebody without putting the harness on them. I'm thinking at some point that person had some pretty significant scarring when they were 5 years old or younger, when they've had, if they need that much need for control in their life. And so knowing that, and knowing I probably can't go back before age 5 to fix that or to work on that, that's just how that person is. That's why I'm saying, Bowen, I don't know. I'm not completely Bowenian. There's some good concepts in here, but you don't want to always think, oh, well, we can fix this triangle. Okay. Bowen also talks about multi-generational emotional process. Not going to spend too much time on that. 79 talks about sibling position. Who's the other theorist that really, and it's not one that we've covered, but just throw it out there. Throw out a name that also looks at sibling position, birth order.
Yeah,
I can't remember that guy.
Psycho.
is this Piaget?
What'd you say, Nice?
I'm pronouncing him in French, so Piaget.
Oh, no, that wasn't. There's good guess though. Piaget is definitely looking at development. It's Adler, Alfred
No,
Adler.
it wasn't an American. Yeah, it's not Piaget. I cannot forget. I remember. I did a presentation on him.
Piaget may have focused a little bit on, but Adler's really the one that's got more fame in psychology.
Yeah, Adler.
Okay.
Was it?
Birth order.
Birth order.
Right.
So that's something that Bowen
Yeah.
also shares. Bowen on page 80 talks about firstborns having it in the middle of that first column. Firstborns have a tendency to identify with power and authority, and then still on that first column, about third or fourth paragraph down, as underdogs in the family, laterborns are more inclined to identify with the oppressed and to question the status quo.
Do you think that?
I think there's a little bit of merit to that. I don't think that's universal, but I think he hit on something. I'll go ahead and skip over to 81 for sake of time. The second column over there is it starts with Carter and McGoldrick. In 1999, described the family life cycle as a process of expansion, contraction, and realignment of the relationship system to support the entry, exit, and development of family members. So they're really looking at kind of a long survival. They're looking more at the family as a evolving organism over time, which I think is good. Let's see here. Genograms. Everybody, if you haven't had talked about genograms before, this is on page 85. I wasn't going to play a clip, but again, for sake of time, we'll just talk about it here. Bottom of page 85. Can I have a reader for the genograms?
Genograms are schematic diagrams showing family members and their relationships to one another. Included are ages, dates of marriage, deaths, geographical location. Men are represented by squares and women by circles with their ages inside the figures. Horizontal lines indicate marriages with the date of marriage written on the line. Vertical lines connect parents and children.
Okay, so has anybody had to construct a genogram? Lauren, you've had, because you've had family therapy. Nice, and Lauren, ever had a genogram assignment?
No, not really, but
Instruments, you do it now.
I have listened to a presentation about it in class.
Okay, they can be fairly useful. I got caught up when I had to do it with just on the symbols and memorizing the symbols, and to me that's really not the purpose of it. The purpose of it is to really just kind of get an understanding of seeing patterns. You know, okay, well, my grandpa was an alcoholic, my dad was an alcoholic. Oh, you know, and going back a couple of generations. And so I won't give a genogram assignment in this class, but you know, recognizing patterns. My grandmother was really passive. My mother was really passive. Oh, am I going to be with it? Am I looking for somebody passive as well? I mean, to recognize, just help people recognize patterns. And it really helps. If you can interpret a genogram quickly, if you're a Bowenian therapist and can get in and memorize the symbols, again, which I'm not, if you can memorize the symbols, it's a really quick way for you to process. So if you're going to do family therapy, and do that a lot, it's probably worthwhile to learn the symbols, because it's just something that you can manipulate quickly. Again, we're not going to do it in this class here. Couples therapy on page 90. Garen, very bottom of the page, 1971, recommends displacement stories to help family members achieve sufficient distance to see their own roles in the family system. If I could have somebody continue reading that.
A displacement story.
Oh, sorry.
Go ahead.
A displacement story is about someone else with a similar problem. For example, a couple too busy attacking each other to listen might be told, "It must be frustrating not getting through to each other." Last year I saw a couple who just couldn't stop arguing long enough to listen to each other. Only after I split them up and they blew off steam for a few sessions individually did they seem to have any capacity to listen to what each other was saying.
So instead of just yelling, "Stop! Shut up!" It may be useful to throw in in that situation, it sounded like the session was getting out of control, the example they used. One of the things that I've used more with this displacement story, I have used that from other clients, but it's to help them feel not so alone. You know, if you tell a story about another family that's gone through similar things, it's almost like group therapy all of a sudden for somebody to recognize, oh, I'm not alone. This is what other people have done. If you can do that without sacrificing confidentiality, please do it. I think it's very useful. I encourage you to draw upon your experiences to help other people. At the bottom of the page, it talks a little bit about triangles. Armed with the knowledge of triangles, the therapist strives to remain neutral and objective. This requires an optimal level, and this is something to highlight. This requires an optimal level of emotional distance, which Bowen said is the point where a therapist can see both the tragic and comic aspects of a couple's interaction. Although people's problems are nothing to laugh at, a sense of irony may be preferable to the unctuous earnestness so popular and so forth. As partners talk, the therapist concentrates on the process of their interaction, not on the details under the discussion. So again, this is, Bowen is really looking at the process and not the content. Last, I'll just, on page 96, right before the chapter ends, it talks about the I position. I'll use I statement on a test, or an I feel statement to recognize that. Okay, that's, to me, those are synonymous. Okay, gosh, that took, I think we actually got into some technique, is why that took longer. Let me see what I've got for videos rather than reading anymore. And nice, do you have a text?
No, yes, I haven't gotten my textbook yet.
Oh, okay. Let me refrain from jumping in there on the other chapters. I'll pause it there, and we'll just extend a little bit more. of our class. I think I've got a little bit of space built into what I was going to do next week with applying family therapy to addiction specifically, which we did. You know, we mixed that in this class too, and so it drew it out a little bit longer. Let me see what YouTube clip I had. I had a few I was going to share. Google does not like Internet Explorer, by the way. It likes Chrome a lot better. There it is.
That's why he wants you to install Chrome.
Right?
Google only works for Google. It's usually just Bing that works with Internet.
You are using an unsupported version of Internet Explorer. Install Chrome now. Nice call. Nice call, and thank you for your, I got Sonia and Lauren, I see your journals showing up. Let's see here. Where am I at? Satir, Bowen. I like Mnuchin. Let's get a, that's a genogram. I don't really want to get, we don't need to spend time on that. This is actually, we'll talk about Mnuchin next week. Is there Bowen in here? Okay, there's Bowen. Okay, since we talked about Bowen, we'll finish off with a little clip about Bowen. Unless we don't have sound. Oh.
In minutes, we're going to watch you work with a couple, and actually it's a family with a daughter. And in this, were there examples of any of these processes or techniques that our audience might look for?
I think one of the most important ones is that this is an example of a family that, you know, they're not a bunch of suits from Wall Street that come in and over-intellectualize. You know, they're kind of a blood and guts Chicago Bears family that come in with, as the father says in it, since Iron Mike's gone, they ain't worth anything. But I think they clearly had an agenda, and I benefited from the fact that others had tried to get them to some very emotionally loaded stuff in the family, and they didn't want any part of it.
This is how you're going to tailor your approach.
So I think you start where they are and where they want, what they want help with. And that was with their adult daughter who has some significant developmental difficulties.
Were there triangles here?
I think there's a clear triangle between the mother, father, and the adult daughter. I think there's some clear, and it sets up with the daughter and the, you know, it moves a little bit. The daughter and the father are aligned in some kind of closeness that the mother resents and doesn't feel she's a part of. And they describe that, but they don't know why it is that way. At other times, the parents kind of get together and try to shape up the kid, and then the configuration of the triangle shifts to we the parents and you the troubled kid.
Okay, so what familiar things did you hear in the clip?
Triangulation.
Yeah. Triangles. We had a little bit of individuation of self, a little bit of fusion maybe between the father and the daughter, and then so the mother is a little jealous. So yeah, definitely some Bowen techniques going on there. This was an introduction to Genogram. Since you didn't have the book nice and I did cover it, I'll show this quickly. And this is from McGoldrick and Carter. Oh,
wow.
Not necessarily that.
Four-time MVP, back-to-back.
Okay.
If you're watching this on Moodle or floated by on YouTube, very warm welcome. My name is Rory Lee Oakes, and in this presentation we're going to look at an introduction to genograms. So, the historical development of Genograms was developed by Monica McGoldrick and Randy Gerson in 1985. Used in medicine, psychiatry, psychology, social work, genetic research and teaching. They were designed to build a picture of someone's emotional life connections in a graphical form, and they're useful for clients with complex family relationships. And they look like this. We're now going to look at a lot more of these symbols in detail, but this is a very basic symbol. On the left we have a man, on the right a woman, and the connecting line is their relationship, in which case it's a grey straight line, which means it's a normal plane relationship. Now, you could have two squares, which would mean a relationship between a man and a man, or indeed two circles, which would indicate a relationship between a man or a woman. So let's have a look at how these symbols actually operate. Well, first of all, this is quite a basic genogram style. And again, we're reminded of male, female, and when we're looking at children along this line, say we have along this line.
So this is where I got a little, right, learning the genogram, I didn't learn from this guy, obviously, but I did see all these symbols and I was like, wow, that's a lot to know, and how am I going to apply that to a client? And I had to do one, and it was like really like pulling it too. So I never really did get into it, but again, if you're going to do family therapy, this can be a quick way, rather than doing a full psychosocial assessment where you're writing all this down over 16 pages. This can be a quick way in your own private practice to symbolize something that you understand, like a shorthand.
Okay.
The elder children would always be on the left and the youngest on the right, moving left to right. So here we have male, female, gender unknown. Well, that could be a twin that was born, one of the twins was born and the other twin died at birth, and the surviving twin doesn't know the gender. Could be an aborted child where there's no gender known. Or it could be a member of the family that's kind of known to exist, but no one's quite sure if it was a man or a woman. Someone related to someone on somebody's side of the family, but they're quite unsure. Pets, adopted child and foster children. And just look here at the way they're connected. This is a blue dash line. This is a square with a blue dash line. And the foster child is a square with green dots. So each one of these is a symbol, represents something. Then you have pregnancy, miscarriage, abortion, death. And then if you look at twins, this is a male and a female twin, yeah, and they're what would be called non-identical twins. And then you've got identical twins, these are female twins, and then the symbol for female on that side. And there's quite a few symbols, so to understand the code, you need to use the symbols and study the symbols. And I'm going to put a link into the bar at the bottom of the presentation so you can download a zip file with symbols in, and also a link to a site that provides software in a lot more detail of genograms. Now, you can have medical genograms or you can have emotional relationship ones, and we're going to look at emotional relationship ones and how they're used in counselling. And
So
you can see...
to cut this guy to the chase, you can see there's a lot of ways to label emotion, and this is kind of the way that the folks were telling me to do it. Is here's how you label emotional closeness. You've got violence represented up there, close violence, fused violence, emotional abuse, sexual abuse is on there. I mean, distrust, in love, hate. The hate with the 3 dash lines there. And you got, divorced, cut off. You got all kinds of things that you can come up with. But again, like he said, you have to use it to know it. And if you're going to do focus on family therapy, it's probably worthwhile to do this, because it's like a shorthand. It's like we can get through this quickly, but for our purposes here, I just wanted you to know it, so if it came up on a test, you would be able to answer a question and get it. let's go ahead and call it a night, and we'll start up with chapter 5, and we will get through 5 to 7 next week and apply as we go along to addictions. Thank you all. Guys, have a good week. Sonia, have a good week.
Thank you, sir.
Thank you, you too.
Okay, thank you.